Check 1, 2.
Well, hello there, boyfriend. How are you this fine day?
I'm really good.
Is it working?
Yes.
Excellent. Let's not touch shit.
I'm afraid to ask, but I have a great question.
I don't even know what I was going to say. I'm so disturbed right now. Lay it on me.
I don't know what it says. It just came in on SpeakPipe. SpeakPipe?
Wait, are you being serious?
Yeah.
You're just going to cold play one?
Yeah, this
That
always
didn't work
goes
out
well for
you
me.
last time.
Excuse me. Hi, this is Jen. I did it wrong the first time, sorry. To quote your beautiful wife, why aren't you single?
Okay, that was it. That was the whole
great.
message. Erika's not my wife. I'd like her to be. But,
That's
yeah.
fantastic.
All right. I did say we were opening up the phones
Jen, I agree.
We're opening up the phones for questions and insults. We're doing a Q&A. Questions and insults.
Yeah, well, we are not married. But I did say that to you.
What?
Are you not single? When you say dumb shit,
Oh, you've said it many, many times. Microphone's on and off.
maybe I'm desperate.
What was I going to tell you? Oh,
Maybe I'm using you for something, which a lot of people like to say.
what was I going to ask
Look at
you?
his arms.
Remember the thing about so you know that I'm trying to figure out right before we started.
I liked that question. You're totally just dodging it.
Oh, it's a real question? I thought it was just an insult.
Oh, that was funny.
What's the question? Oh, why am I not single?
Yeah.
Oh, sorry. I wanted to move
I
past
want
it.
to give
It
her
was,
credit. I like it when people leave
insulting.
us questions. I
Oh,
think
so
it's
you're saying
funny.
I'm not single because my arms are big? That's
I
one
was
of
like
the reasons?
saying your attributes. Like,
Oh, that's nice. Okay.
like what am I using you for?
I misunderstood. I thought it was a straight up insult. I didn't realize.
He's great at moving my furniture.
I am. I just did a little bit of it.
You're my IT guy.
I do. I
You
really.
have very white teeth.
Okay.
Did you know before I ever met you in person, I went and bleached my teeth like the day before I flew to Denver because you had really nice teeth and we talked about how white your teeth were.
did?
And I was so scared that I would have not as nice teeth. So when I surprised you, so I was like, hi! And my
Your
gums
teeth-
were like bleeding because I
Your teeth
had
look
them.
white
They
as
weren't good
shit.
enough. So I
They
had
were
to zap
very
them a
white.
second time. Like I went
That's
to a
amazing.
place.
I still can't believe you did
It was the
anything for me.
teeth. He got me at the teeth.
How about I admit something to you that you don't know?
Uh-oh.
Ready? So I feel like I do things around the I'm a pretty, right, like you said, IT guy. I've hung some pictures.
Oh, yeah.
I've so this one day there's something about Erika that makes me I want to like be able to do what she needs me to do. Like there's something that makes me go. For instance, you had a Ring doorbell. The doorbell, the chime, it's so high up in the sky. You have to have like a special ladder. It's frighteningly
so heated
high
right now.
It's so high. And I just go, yeah, I can do that. Of course. And I'm in my head, I'm like, I don't know. That's very high. I'm not sure. But there's something about being with you that makes me want to do things for you. I told you also I'm an anxious person, but when I'm with you, I'm not. I want to like take care of everything. I want to be like, no, I got this, right? So you had said that you were practicing silks and you wanted me to put something on your ceiling so you could hang like a home silks thing. What that would involve would be hooking something up to a ceiling that's very high that could hold the weight of a person. If it didn't hold the weight of a person, that person might hurt themselves and or get a head injury. So this is I feel like this request is very like, oh shit, like this is something that has to be done correctly.
Yeah.
And I remember just going, oh yeah, I could totally do that. And then standing upstairs and just being like, this is like a real, but there's this thing where I feel like I don't even know what I'm saying. I don't even know if this is good to even talk about on the podcast, but you do this thing for me. Maybe this is too lovey-dovey bullshit, but you do this thing for me where you make me feel like I am capable of all these things, where if I was alone, I didn't have to do it for someone. I would have hired someone to put in the thing on my ceiling because I wouldn't have trusted myself. But when you ask me stuff, hey, can you hang up the thing?
Well,
I went
just
upstairs.
assume- yeah, you did a great job.
I think it took me 11 minutes to hang a silks thing.
It's pretty impressive.
And I even hung on it myself. And I did whatever. So I think this is part.
I know. That was cute. You tested it out to make sure it wouldn't fall on your weight, so then I could get on it.
And remember,
That was
I go,
nice.
let's make sure it can hold both of us in case
No.
we get drunk later.
No. It's for exercise. Stop it.
You just said sex was exercise.
Not
Don't make me
that-
go to the tape.
Wow.
But it's twofold. I'm lying a little bit. It's twofold. One is like you make me feel I'm capable of these things. The other thing is I want to.
Impress me.
Yes.
Ooh. Impress me, Jamie. What you got?
Well, 5'9". Do you know I thought I was 5'9"?
I don't.
We don't need to go there. I thought I was 5'9" for a really long time. Then I started doing the joke on stage about how I was taller than Gutfeld. And then after a show, this lady goes, "You're not 5'9", by the way." I was like, what? I'd been 5'9" for 48 years. And then I was told I wasn't. And then I realized I'm kind of like...
I bought high heel tennis shoes for myself.
I know, thank you for those. Oh, I thought they
for
were for me.
myself. They're gold.
Oh,
Did you see them? They're so cute.
To make me feel more like shit?
No.
Awesome.
They're stylish. They're like wedge ones, but they have them for guys too.
Oh.
I'm not saying you need them. I'm just saying I saw an ad once where every guy lied. It was probably for these shoes to like make you think that, oh yeah, see, we need to be taller.
Every guy lied about
you don't need them.
their height?
They were like in a gym and they were like, how tall are you? And the guy was like, I'm 6'2". And they're like, stand up, let's measure you. And the guy's like, oh, get away from me. No, I'm not. Stop it. And they get really mad because they got caught in a lie. And like every guy they asked except one refused to stand up, or if they did, they were off by several inches. So I don't think you're uncommon there. But this one obviously was marketed to get people to buy their shoes. I think you're perfect. But
That is funny, though, because I remember...
women don't do that. They do it with their weight.
Age, weight.
I don't lie about my age.
No, not you. I
just
don't
don't tell
group you in with other women. When we talk women, when you say like men are assholes, I don't think you're talking about specifically me. I'm just saying in general. But I think men, and maybe I'm wrong about that video. I didn't see it. But when I lied to you about my height, I wasn't going like, I'm going to tell Erika I'm taller than I am. There's part of me that believed that I was. I knew it was probably shorter than that because I had some people question it. But I just kind of said it, and you even said it. I said it like I was going to ask you for. I don't even know. I'm afraid to ask. Forget it.
Do you think that like EMTs, when they're helping someone on the side of the road, ever even look at their driver's license to know their height and weight? Because they know everyone lies.
Oh, you mean to try to figure out
If
how
they're
much
like,
shit
how
to
much
give them?
medicine of something do we need? Like most of it's not weight adjusted for like aggressive cardiovascular life-saving measures. Like it's just like you get this amount, this many mgs, whatever.
That's why they weigh you and don't ask
For
you.
anesthesiologists, it's different because they have to keep you sedated. But for like stuff to like shock your heart and like get you back, it's pretty standard. But wouldn't that be fun? Like they don't look at your driver's license and be like, how much does this person weigh? And they're like, well, it's a woman. Add 30 pounds. That's what they'd have to do for me. My driver's license is on point.
I would say 5'9". They'd be like, this short guy stole a guy's driver's license. He's his symptoms are he's getting shorter. Want to
You know
hear?
how they give you the options of getting a driver's license every year or 4 years, and then they're like, or you can pay a little extra and you can have it for 10 years. I'm like, 10? Because I don't know what I'm going to look like in 10 years. Guess what? The 10-year one expires for me this August.
Does it? I can't wait. You know why? Of all the insults that you level at me,
You have a terrible picture.
My driver's
you look like a
license.
serial killer on meth, passing bear cubs in the picture.
it was COVID. And it looks like I'm wearing a white turtleneck, but it's a bandana. I used to be a bandana guy during COVID. I thought it was getting over.
Doesn't look like a bandana
and
either.
it just makes it look weird. And I think I'm wearing glasses and I don't know.
You look like you just came off of like a winter foraging 10-year hike and you found civilization.
It's not a great picture. So I should get another one. I need my driver's license to drive those bodies around. I'm sick of carrying them. It's a terrible picture.
Well, at least that's consistent with the story.
Do you want to hear a true story?
Remember
about...
you made fun of me just the other day. I was making fun of you, so you grabbed my license and you're like, screw you, Erika. And then you grabbed my Costco card and you flipped it over and you're like, haha, screw you, Erika.
Yeah, you have some great... It's fucking annoying. Do you want to hear a true story about someone lying about their weight?
What?
It could be dangerous. This is a true story. Swear to God. True story. I'm flying. I'm performing somewhere in Alaska. There's a guy in Fairbanks, Alaska that would take us to do these little tours, and you would take little planes and you'd go to all these different little, sometimes it'd be a community center and it'd be the whole town and you'd perform for them and do a stand-up show. It's kind of fun. And we go to the airport, and it's this tiny plane. And they go, there's a guy up there. And they go, how much do you weigh, sir? And he's like, oh, I don't know, 190. Okay. And they weigh his bags, and then he walks. And then this woman gets on in front of me, and they go, how much do you weigh? And she goes, 120. And I'm like, that's not. It's not 120. Our lives are at stake. And this lady goes, I weigh 120. I get up there. They go, what do you weigh? I go, 210. I took her weight onto mine. I added her weight to mine to save everybody.
Do you think you added enough or not enough?
I mean, I really tried to do it like a carnival guy. Like, I really tried to look at her and go, I don't think so. But
did you tell her? Don't worry, ma'am. Your secret's safe with me.
Don't you think, though, they should start weighing people? Because I wouldn't get mad if a woman lied. I feel like those are kind of harmless lies.
I've never been on a plane where they've asked my weight.
No, I don't know if you've ever been on a plane like that I was on. This is not Alaska Airlines or United. This is like a Bush pilot flying 6 of us.
Well, that is important. That's very important.
Yeah. If I didn't make that clear, it was your bags couldn't be more than 20 pounds. Everybody got like 20 pounds, and it was all about safety.
Yeah.
So I'm not trying to be a dick.
Yeah.
I'm glad you clarified that. I am just trying to save everyone's life. I go, you pick up a few elbows. You got to tell that guy.
You know, that's like the water park. They weigh us.
They do?
Mm-hmm. The one I'm going to take you to.
What do you mean?
Why
does it matter?
A lot of the rides.
Each family only gets like 800 pounds? Do they charge per pound?
No, they make you leave if you're over.
No. No way.
Yeah.
Not
you have
in
to get on a
today's
scale. You have to get on a scale every single time. Well, because
how is it not an uproar?
It's for 2 people. You can only weigh so much, because I think if you weigh too much, some of them you could go over the side, because they're like really steep plunge ones that then scoop up. So with your weight, you'll go faster, right? So like if you weigh too much, they're worried about safety. So they'll say, "Oh, I'm sorry, you have to ride single. You can't go double." So
I see.
They don't not let them.
What if the lady's like, "This is just me," and they're like, "Whoops."
But there's like a family one where there's 5 of us that can go in one too.
Yeah.
And you all have to stand on a scale. And if you're too much,
together?
They kick. Yes,
okay,
together.
I like
then
that.
they kick one of you off. But I did have a guy. It was kind of sad. He was in front of me, and he wanted to go with someone, and they're like, "You can't."
Oh,
sorry.
They're like,
and
the good news is you can be the tube. We'll use you.
But I was nervous because I don't like to weigh myself.
I would hate to weigh myself.
So
is it the place? Do I know the name of it?
Yeah, but
Okay.
I don't want to throw shade at it. I really
want
like
to see. I want to see what the weight limit is. Do you know what it is?
Every ride is different because it depends.
You're telling me I have to weigh myself before every ride?
Yes. When you get to the top of a lot of their water slides, the extra like speed long ones,
Yeah.
they make you weigh yourself. Not all of them. Like if it's an enclosed tube, you don't.
I
But
can't believe this.
What?
At the place you're talking about,
Yeah.
guess what the maximum pounds is per seat?
250.
210. That's low.
It's slow.
That's not nice. But maybe you're saying you could get on a bigger one.
By yourself.
Yeah.
I'm assuming so, because they offered the ride to that gentleman, and they don't say it rude. I mean, it's like teenagers who haven't had another job usually.
Oh, good.
So you would
How
think
do they
that they
say
would
that?
be
They
like,
go-
get out, and they're immature. No, they're very respectful, and they're just like, I'm sorry, you exceeded it. You can go solo, or you can go back.
Well, that's
down.
good. They're nice. Like, sir, I'm very sorry. You're unable to go on the ride at this time. But the good news is you've gotten the high score. If you'd like to put your initials into this machine, we'll get a
You
prize
would've
for
gotten
you
fired from
inside.
that job very fast.
Yeah, I would have trouble. Well, I feel bad for those guys. Well, I mean, at least they got the big pod, and they can all go
But
together.
certain things are important about your weight being accurate, like the airplane or the water
Anesthesia?
slide. They're not being jerks.
No,
and
they're
it goes
not.
the other way too. Like with children, if they're really low weight or they're short, they're like, you don't have enough weight for this ride. It's dangerous. You can't be on like certain carnival rides and stuff, amusement parks. So I don't think it's
not
being mean. I think it's very important. The problem is so many people lie. I've never been to another place that actually makes you get on a scale though.
Yeah, that's crazy.
Well,
That's crazy. I don't even think we should get into it. But there is this whole movement of people that are going to say, I'm healthy at any weight.
It's not true.
You should
I don't even care
change
if
your
I get a hard
slide
time.
so that I can go on your slide. This is not fair. Even if we're trying to like save a person's life, or you don't want them to go flipping off the slide, there are absolutely people that are going to be super upset about, I don't think 210 is that high either. But there are certain things we can't do because of our weight. I can't be a ballet dancer. It goes the other way.
Yeah.
You can't. It's, but people want to take it personally.
Well, I have a big problem with that. All physicians do. I have to phrase things very delicately, and I'll even say it on here. I don't want to get hate for it. I do respect everyone's autonomy and their choices.
Sure.
That's their life. But if you come to me with a health-related question and you say, how can I get better?
Yeah.
If you're morbidly obese, it is irresponsible of a physician to say, you're beautiful at any weight, you're healthy at any weight.
Yep.
That is frustrating to me. You do have to have someone.
True.
If I can't say it, who can? Seriously, if I can't say it, I'm not fat shaming, body shaming anybody in a fitting room or in a water park. I'm not. You do you. But if you come to a doctor and you get offended because they say you need to lose weight, if they say, hey, and they call you names and belittle you, sure. But if they're polite and they say, listen, for every extra pound, by the way, your heart has to pump harder to supply that whole pound of tissue. That's more blood vessels. That's more pressure to supply the whole body with the oxygen and blood and nutrients that you need. It's a fact. So if you're morbidly obese, are you going to have cardiac-related problems? More than likely, yes. And are you going to have them right now? No. I know this is an uncomfortable topic, but I'm not done talking. I've gotten people who have called in and yelled at me and said I was disrespectful because their medical chart said obese. And I said to them...
Isn't it a medical term? Isn't obese?
Yeah, it's based on your body mass index.
Yeah,
so
it didn't say
25
like fatty
or
McFat
higher
or something. It said
you're
obese.
overweight.
Yeah.
And I can't change that.
Right.
But I've had people actually yell and leave my practice and say, I'm not staying unless you delete it from my chart. And I go, I can't.
Wow.
That is important for us to discuss. So
I'm out of here. Where's the biggest exit?
No, you can have tact and also candor.
Yeah, I agree. I just think...
But I'm impressed with patients who take my advice and get healthy.
Of course.
And see the positive benefits. And I also realize obesity is a big struggle and it's not something to throw shade at. But man, it pisses me off.
I've actually gotten a lot of shade from...
It'd be different if it was a bank teller who was like, I'm not going to help you because I don't like the way you look.
Sure.
But if it's your physician who honestly cares about your lung capacity, let him talk.
Sometimes big people throw a lot of shade.
See, that's messed up.
No, me and my friend were at the beach once.
That's
and we were like,
don't even finish that one.
Yeah, I completely agree with you. If they're at the doctor, they're asking for your advice. If you're walking down the street, even as a doctor, you wouldn't say, "Hey, lose some weight." I do think the frustrating thing and the problem is the obese person. They know what to do. They just can't. It's really hard.
Well, but I talk about options: medical, weight loss, surgical procedures.
Yeah, that's true. You provide more options.
Diet plans, nutritionists, consultations. I mean, there's a lot of options out there.
Sure.
So that's where you just have to start the discussion. You know, I worked at a medical weight loss clinic when I was in residency for a couple of months, and it was hard for me because all of the doctors really practiced what they preached, which is good and bad, right? So they were extremely physically fit, very, very thin, not unhealthily, but on the very low end of a normal healthy scale.
Yeah.
And you had all these patients coming in with body image issues being told by someone who is eating 500 calories a day, sometimes, like keto.
You're saying they were in too good of shape.
I shouldn't say 500 calories. People were like, I don't want to hear advice from someone who has it so easy.
Yeah.
These beautiful people. Flip side, do you want to take medical advice from a morbidly obese doctor who tells you that you need to lose weight?
My old doctor was like up with the picture of death's door. And I remember every time he would say something, I would just go, I don't know. I can't take you seriously. Like I had one time I told you, and I think you told me this happened to you once. I had gotten in very good shape. I was just like, but really doing a lot of weightlifting, like not as much Peloton. I was just trying to get like jacked for a while. I don't know why. And I went in there and that thing happened. For the ladies. More for myself, honestly, and some of the other guys at the gym.
For the dudes.
For the dudes.
For the dudes.
And I went in there and they told me I was obese because of my BMI.
Oh, yeah.
Body mass index was...
I did that once to somebody and I felt so stupid.
You did? You know what I did? I want to swear I was so mad. It made me so mad because I was working so hard that the lady comes in and she goes, the doctor's going to put you on a weight loss program. And I go, what are you talking about? I go, I am on I've never been in better shape. Like, I wasn't ripped, but I was like 8-9% body fat.
Yeah.
And he came in, he was like, buddy, we could all stand to lose a couple pounds. And I flexed my abs.
Did you rip your shirt off?
I did.
And you were like,
I go, I go look at my abs. And
so that happened to me once, and I was so mortified.
He goes, I'm sorry, I'm the one that needed to lose weight. That's what he said.
I've said that to people too.
So what happened with you?
So, well, the MA goes beforehand and weighs them and gets their height and everything. So that BMI is in the computer before I even go in the room. It turns it red if it's like 25 or higher. So I see that it says he's obese. So I'm like, oh. So I go in the room. He's wearing a really baggy like sweatshirt and baggy sweatpants. So I can't tell. Yeah. Honestly, couldn't tell. So I'm doing a physical. I go through everything and I'm like, wow, your labs look great. All of this stuff. The only thing that I see, your blood pressure is even healthy, is your weight could probably go a little bit lower. So for advice for the next year before I have to see you again, what are you doing for like cardio and stuff? Because you could probably, let's just get that number down a little bit. And he just started laughing.
Was he like a bodybuilder?
Yes.
Yeah.
And I just looked at him and I was like, what? I'm like, your BMI. And he's like, I go to the gym every day. And he did this. And I was like, oh shit, I'm so sorry. I couldn't tell because you looked chubby in your clothes because they were so loose.
Well,
and but I had to call myself out and go, dude, we know myocytes, muscle cells, right? Muscle tissue, muscle weighs more than adipose tissue, fat tissue.
Right.
So like, well done. Bravo. Your BMI is high because you have no body fat. I'm sorry. I don't think I said I need to lose weight too, but I said something like that. I'm like, you're in way better shape than me. I do not need to talk right now. You do.
But that's what I like about you, or the way you practice medicine, is I think that's a very extreme example, but I think there's
I felt so dumb.
Some doctors that still stick to the BMI thing without going, there's these outliers where it doesn't really work for you. This is for like regular Americans.
Well, then you need to find a different doctor.
I'm not gonna. I'm keeping my doctor.
Well, I think that there are so many things about like vibing with your patient too. Like, I'm a very different doctor than a lot of other people out there.
Yeah, I'm never had a doctor do some of this stuff.
I get loud. I have fun. I dance. My patients do the same thing. I want them to leave happier than when they came in. And
you do that.
You just have to vibe with them.
Hey, you were my doctor this weekend. I had a
What did I?
I'll do this real briefly. I woke up. I had gut
I'm sorry,
felt.
I'm laughing. It's hard to be your doctor sometimes.
Everything's okay now. But I woke up, I had to do the Gutfeld television show, which involves having your face on TV.
Sure
and
does.
It also involves writing jokes all day. It's a bit of a hard day. You write the jokes and you go on. You want to have a good face for TV.
Have a good face.
I woke up.
Not a good face.
Not a good face. One eye closed.
One eye
closed with, I had a pain, a shooting pain in my upper left of my eyeball. And I call you up and I go, hey, I don't want to alarm you, but remember yesterday I could see out of both eyes? Remember I could open both eyes nice and wide? I go, I think something's going on. And so you ran me through a battery of tests or something like that, right? I don't even know how we did it. Did we FaceTime? Or something?
I tried to FaceTime you and you wouldn't.
Oh, yeah. Topic for a whole other day. I looked so bad. My eye was so messed up that even though we're in a very serious relationship, I thought you might reconsider after seeing my face. Might have? Reconsidering now. The right call?
You didn't look good, but like not like a judgmental way. Like it looked way more serious than I thought, and it was worrisome. And we did have to zap it quickly with stuff to take the swelling down, right?
Yeah, so we did stuff to take, and I only have two little points here that I wanted to bring up, and then we will wrap this up. But I wanted to tell you, if you realize what happened, the swelling went down. Erika helped me. Makeup really helped. You could kind of tell on Gutfeld. I think we briefly mentioned it. I was surprised that Dr. Erika gave me, I believe it was antihistamines and a Spider-Man outfit.
No.
We decided it was a spider bite. That would have been important information.
Not give you.
We think it's an insect bite. But anyway, I finished my Gutfeld dates, the 2 nights. Everything goes pretty good. I'm driving, and I realize I'm having trouble reading signs. Not just exit signs, but billboards. Very large lettering. Like the E on the vision chart. I got nothing. And I don't like to call you because I know you're going to be worried. But I go, this is like, I can't see shit. And I'm driving 3 hours in South Carolina to do these shows. And so I call you up and I go, I'm worried my vision's very impaired. And you're like, is it the right eye? Is it the left eye? And I'm not good at explaining things. So I confused you and you were getting irritated with me. And then I go, Eric, I'm just worried about my vision. And you go, well, if you have like inflammation or something, obviously your vision might be bad in that eye. You're going to be fine. And I was like, I don't think I'm going to be fine. I was arguing with you. And I was worried about my eyesight, and I wanted to go to an optometrist or whatever they are, ophthalmologist. And then you said something like, look in the rearview mirror. And I looked in the rearview mirror, and you were like, is your eyelid like occluding? I don't know if that's the proper use of that word. Like your pupil? Like, is it in the way of your pupil? And so I looked in the rearview mirror, and I noticed that my eyelid was actually in front of my pupil.
Open your damn eye.
And then I went like this, and that was the cure. It got cured by going like that.
Well, that's why I asked you if it was like bilateral blurred vision or if it was unilateral, like it was the affected eye or both. And you were like, I don't know, I can't see.
Yeah.
Like,
next time maybe you could go, hey, is it
damn
one
eye.
eye or both? Without all this fancy trying to fucking confuse
I did
me.
hide you from stuff, by the way.
Because of my eye was so ugly?
Well, remember I asked you if it was just like one lid or all the way around.
Oh, yeah.
Because stuff that's circumferential is a lot more dangerous. And you can see behind your eyeball.
Did I ever tell you that once I got accused of a crime, but they only had circumferential evidence, which was not enough to convict?
You know, I withheld scary stuff from you.
Thank you.
Like trypanosomiasis. What is it? No, I know this one.
Okay.
I'm going to look it up.
It's
Trypanosomiasis. It's also called Chagas disease, and there's a bug that bites people's eyes, and it looks like what you have.
Oh my God.
Well, I didn't tell you.
Very glad you didn't bring that up.
I didn't tell you because
It's
an extremely low likelihood because you weren't traveling in the areas where it's endemic. It's usually like in Southern Hemisphere countries.
I don't even want to tell you this, but it occurred when I was trying to get a
or at
really,
least
really
further south than where we're located.
I was trying to get a really good look at a bug
Hold on, I'm going to pull it up.
when it happened. I'd seen a bug, and I got let me get a closer look. Do you know why I even brought up this topic?
You're not going to like this.
Well, now that I'm better, I'll tell you what. When you hurt your eye and you can't see out of your eye, you will never take your vision for granted ever again. Every day I wake up, I go, I cannot believe, like, even at my shows, I go, look at all these empty seats. Okay, this is Chagas disease. Oh my God, it looks just like what I have.
I know.
An infectious disease caused by a parasite found in the feces of the tridamine bug. Chagas disease is common in places where the tridamine bug transmit. Yikes.
Yeah. But I didn't need to tell you that because you weren't recently in like Mexico or other warmer South America. I don't know. All the places. Africa, maybe. It's not common in the U.S.
Okay. Well,
so I have to look at the most common variables. But you know, you're missing a very important point. And before we wrap this up,
I'm missing a lot of points, Erika. What?
You're welcome for not telling you about that, by the way. I think you would have like lost sleep over that one.
What am I missing?
The other reason why your vision might have been all of a sudden jacked up is because somebody didn't follow the doctor's orders on how to take their pills.
Oh, yeah. There were these 5 pills.
There's more than 5.
And it says to stagger them.
There's more than 5 pills.
And I go, it'd be quicker if we just took them all.
That's not what you did.
What do you mean?
You said on the box, it said take pills daily as directed or something.
Yeah.
And then you open it up and it's like a bubble pack and there's written instructions under each bubble.
Yeah,
but you didn't read that. You just read the outside that said take pills as directed daily. And so you just took all of them.
This
So
one
you were
time?
like roid raging like a mother.
This one time? This is a true story. I was really having trouble sleeping.
Yeah.
And I said, I feel like I need to take something and quiet my brain down. I wouldn't normally do this. And Erika said to me, you can either take... No. She said, you could take... And I'm going to make up words. She goes, you could take no-dose. You could take this hydroxyzine. You could take melatonin. You could take this or this. And you remember what word I didn't hear? I didn't hear or. And I go, okay.
I was
And I took
very
everything you said.
specific.
I did not hear or. And I go, oh, she said to take all that
I didn't
stuff.
throw out like a or. I was very specific.
And then
you have
remember the
all
next
of
day?
these different options. I was surprised that you survived the evening.
But remember, I didn't answer the phone, and it's because I took all these
Yeah, you probably had severe respiratory depression. Is what happens.
Severe,
You slow
awesome
down.
fucking rest.
No. How about the time that you had a little blue pill? Not that one. Viagra's blue.
Okay.
So people like reference that.
Yeah. I'm familiar.
not talking about that
I'm
one.
familiar. What's my little blue pill?
Aleve versus Unisom, and you took the wrong freaking one.
I've done that more than once. I have loose I had loose
You
Unisom.
can't do
and for
that.
months I would go, my leg hurts.
And you
I'd be
take
like,
a Unisom and you'd be like, I'm sleepy, but at least it doesn't hurt anymore.
yeah, that happened for months. I was taking
And I
Unisom
just slap it
instead
out of
of
your
Aleve.
hand and be like, what are you taking? You're not taking the right thing.
Total
You
placebo.
can't date a it's not placebo. Probably sedated you so much you couldn't feel anything.
So anyway, keep your pills in your bottles for safety reasons. To know
And
what
read
you're
the
taking.
damn instructions.
Read the instructions. This is Afraid to Ask. Coming up on the next episode of Afraid to Ask.
I've put breast implants in on someone and it was so scary because
Yeah?
it doesn't matter the size. It matters the type of implant.
Yeah,
for
I've
the
tested a
cost.
bunch out, but I've never.
Jeez, it just set you up for that one. No, but
Mhm.
like the plastic surgeon handed it to me. And I'm scrubbed in and he goes, do not drop that. That's like whatever, how much money.
Yeah.
And I was like, ah. So I'm like holding this
You know what size
Water
do you think it was?
balloon.
It was like a C?
probably. And we made a very small incision, and then you had to stuff all of it in, and
Wow.
I'm scared it's gonna like rupture.
Of course.
Or we're pushing really hard, and the other side squeezes back out. I'm like, if this thing flies across the room, I'm dead. I'm dead.
Yeah. Crazy. Isn't it the body amazing?